Hi, I'm Dr. Pavanka, and I want to talk a little bit about preventative care. So one of the things that we should all be doing for preventative care is doing our yearly exam. This establishes our veterinary patient-client relationship so that as your vet, we can go ahead and continue to keep your animal on any medications they might be on or any prevention or other prescription items such as prescription foods they need. With this, what we're really trying to do is screen them for any issues. We want to make sure that we're seeing healthy teeth, we're not hearing any new heart murmurs, any lung conditions, any problems as far as skin, nails. We don't want to see anything overweight, we don't want to see anything underweight. So we're really looking to see in general what we can do to make sure that we're being an active team member and keeping your pet as healthy as we can, because we want them to have long, healthy, happy lives with you guys. With that exam, a lot of times we also do go over other things. The top thing that most people think of is, I've got to take my animal in for their shots yearly. So we typically do our annual exam, we make sure everything looks healthy, looks good. If we have any recommendations based on that exam, we'll let you know so we can help manage any conditions and hopefully find any conditions before we find that the animal's in crisis from them. We also like to do vaccines to prevent diseases. There are kind of two general categories I think about when I talk about vaccines. One is our core vaccines. That includes rabies, which is a lot of times a legal problem too, as far as if your pet's painful, they can't tell you they're painful, so a lot of times they'll show you they're painful. And even the sweetest animals can decide to show you teeth and bite when they don't have any other options to tell you, hey, stop that, I don't feel good. With that, if they bite somebody and they don't have a rabies vaccine, there's no way to really test them to see if they have rabies when they're alive. So that becomes kind of one of those legal matters that nobody wants to get into. So we do recommend rabies at the very least, but there are other core vaccines that we do recommend. It really varies depending on what species you're talking about. Horses have their specific core, cow have their specific core vaccines, and our dogs and our cats have specific core vaccines. Even ferrets technically are supposed to have their vaccines because they can get rabies and heartworms just like other animals. After we talk about the vaccines that are core vaccines, you also have lifestyle vaccines. These are like the kennel cough vaccine. If you go to grooming, boarding, daycare, anything like that. I have had coworkers that their dogs did not go to any places like that. They stayed in the yard, they never went anywhere, and they still picked up kennel cough because they had other dogs walking around the block that were sneezing, coughing on that yard, that fence, and unfortunately that dog got kennel cough because he was not protected. I do kind of simplify the kennel cough vaccine when I'm explaining it to people, as far as it's kind of like the flu vaccine. It takes care of one of the more common causes of kennel cough, Bordetella bronchoseptica, but it doesn't take care of all the things that cause that kennel cough sign that we see. So we can still see kennel cough, but typically it's a milder form. After we talk about vaccines, the next step would be to talk about preventions. We do recommend, at least at my clinic, to go ahead and have them on a heartworm prevention that also does intestinal parasites, as well as a flea and tick and ectoparasite prevention. If your pet has seizures, this is more dogs than anything, we do technically require them to be on a topical, at least at my clinic, just because the oral will decrease the seizure threshold and you might see more seizures with that. It doesn't typically cause seizures from my understanding. Every time I read an article about that, it just lowers the threshold. So if they are already prone, we're more likely to see seizures. That said, it's still really scary if that happens. My dog was one of the ones that happened after he had Simparica Trio. Simparica Trio is pretty safe. Honestly, it's more palatable than a lot of the other ones. So I would still recommend prevention, even though I've had one who's reacted to that. I've also had a pet react to vaccines before, and I still 100% recommend vaccines, just because a lot of times the reactions are more mild. And if you tell us about your concerns, a lot of times we will try to work with you and see what we can do to prevent them. I do like to use pre-medications for a lot of our pets that have soreness or even have mild reactions, just to make sure that we get those vaccines that they really need. If they're really, really bad reactions, that's when we discuss how we proceed with vaccines. So do use us as a part of your team because we want your pet to be healthy. We want to make sure that we set them up for success with that. In order to get your prevention though, at least at my clinic, we do require a heartworm test, which makes sure that if they do have heartworms and we give the prevention, we don't have any adverse side effects, because that has happened where the dog had heartworms, nobody knew, and the dogs were given the prevention, and because the worms dying off causes a lot of inflammation, we can have anaphylaxis or severe allergy reactions with that. So we do require that heartworm test that also screens for tick-borne diseases, and a lot of the tests, the one that we use at Village Vet does Ehrlichia, Anaplasma, and Lyme disease, which are all things that we see very commonly in this area. If you have any questions about preventative care, do let me know or call your vet and they can clarify. But that's kind of the gist of everything as far as preventative care. And I'm going to go a little bit further into blood work in the next video. Thank you.